Cuando se creó la Universidad Francisco Marroquín, nunca fue concebida como una institución educativa en sí, sino como un ideal, como una causa y como un poderoso agente de transformación. Esta es la diferencia entre la UFM y cualquier otra. La academia es el vehículo, claro, pero no el destino de lo que hacemos. Desde su primer día de vida hasta este preciso momento, la Universidad Francisco Marroquín ha existido para encontrar y nutrir mentes brillantes y para plantar en ellas la urgencia de preguntar, argumentar, transformar y elevar la realidad que les rodea. Nos urge la obligación de cuestionar los dogmas, sean del tipo que fueren. Nos rebelamos contra las tradiciones. Vivimos para crear nuestro propio destino, no para seguir mecánicamente reglas impuestas por otros. Existimos para forjar nuestros propios pensamientos, no para creer a ciegas en los hallazgos de terceros, por sublimes que parezcan. Creemos en el individuo, único con capacidad de pensar, razonar y actuar. ¿Por qué? ¿Cómo? ¿Qué pasaría si? Este es el inicio más frecuente de las conversaciones en nuestras aulas. Creemos que no hay herramienta más poderosa que las preguntas, ni fuerza capaz de doblegar las ideas. Por eso no nos interesan las respuestas prefabricadas. Para nosotros no hay verdades absolutas. Creemos en la libertad como en nuestra brújula y en la responsabilidad como en nuestro norte. Nos inspiran los ideales y acciones de pensadores, maestros y fundadores, individuos que han transformado la historia. Nos consume buscar, encontrar y acompañar a jóvenes mentes en su búsqueda personal y dotarlas de las herramientas para que al cambiar su destino, alteren la historia y empujen adelante a su comunidad, a su país y a su planeta. Estas no son simples palabras. Llevamos 50 años actuando. ¿Tienes alguna pregunta?
On behalf of the Centro Henry Hatzlet at Universidad Francisco Marroquín, I welcome you to the conference, What's the Relationship Between Public Choice and Pandemic Policies? I am Luis Carlos Araujo, student of the Instituto de Estudios Políticos y Relaciones Internacionales. Public choice applies the theories and methods of economics to the analysis of political behavior, an area that was once the exclusive province of political scientists and sociologists. Public choice originated as a distinctive field of specialization a half a century ago in the works of its founding fathers, Kenneth Arrow, Duncan Black, James Buchanan, Gordon Tullock, Anthony Downs, William Niskanen, Mancur Olson, and William Riker. Public choice has revolutionized the study of democratic decision-making processes. As James Buchanan artfully defined it, public choice is politics without romance. The wishful thinking it displays presumes that participants in the political sphere aspire to promote the common good. In the conventional public interest view, public officials are portrayed as benevolent public servants who faithfully carry out the will of the people. Public choice economists make the assumption that although people acting in the political marketplace have some concern for others, their main motive, whether they are voters, politicians, lobbyists, or bureaucrats, is self-interest. To talk about the relationship between public choice and public policies during the COVID-19 crisis, let me introduce you to Chris Lingle. Chris earned a doctorate in economics from the University of Georgia in 1977. Since then, he has been employed at universities in Africa, Asia, Europe, Latin America, and the United States. He is a passionate supporter of human creativity and voluntary actions that lead to social harmony. To this end, he travels relentlessly to engage in discussions on the merits of institutions and public policy in terms of their impacts on human liberty and dignity. Currently, he is a visiting professor of economics in the Escuela de Negocios at UFM, adjunct scholar at the Center for Independent Studies in Sydney, and the research scholar at the Center for Civil Society in New Delhi. His research interests are in the areas of political economy and international economics, with a focus on emerging market economies and public policy reform in East and Central Europe, East Asia, Latin America, and Southern Africa. Please, students and the general public that are attending this conference, write your questions in this conference post, and we are looking forward to answering them in our Q&A segment. at the end of this conference. Chris, thank you very much for your presence.
It's a great pleasure to be here. I both envy the students who have been able to be part of this wonderful university, and I'm very proud, and it's a great accomplishment of my career to be part of the UFM family. And I applaud you and your parents for making these good choices to participate in this outstanding university, one of the best. And I've taught all over the world, and this is one of the best that I've ever been associated with. I've been with UFM longer than some of the listeners have been alive, perhaps. I first came in 1997 and began lecturing in 1998. And I come frequently for short visits, as I'm doing now. I'm very pleased that the Centro Henry Hazlitt invited me to talk about this very timely issue as it's unfolding here as we speak. The attempt to impose a state of emergency by the president and the resistance of the Congress. So this is a very timely issue. Now, I start with a few quotes here, and starting with Henry Hazlitt, and it's about the importance of looking into the future and trying to understand how a policy will impact not only the benefits, but also the costs. And I think one of the problems with the public policies relating to the COVID-19 pandemic is that leaders have generally ignored the costs or overlooked the costs of their policies. Emergencies have always been the pretext on which safeguards of individual liberty have been eroded. And we need to be alert to this because governments take on powers that they don't relinquish during emergencies. And the whole aim of practical politics is to keep the populace alarmed and hence led to safety by an endless series of hobgoblins, most of them imaginary. It's a slight exaggeration. H.L. Mencken is a great entrenchant critic of government intervention, but his comment here is relevant because fear has been a very important tool of governments in implementing and pursuing public policy. Two politicians, French politicians, the president of France, Emmanuel Macron, at the beginning of the pandemic said, we're at war against the virus. And the prime minister of France at that time says, we have to mobilize all our forces. Well, another observer said, war is the health of the state. We should all be worried when political leaders use references to war because that means that citizens must make extreme sacrifices, including giving up their life for the state. So this sets the sort of general framework of my observations that I'm going to make here. So let's get started with this idea that, first of all, human interactions are extremely complex, and the attempts by governments or individuals, autocrats, dictators, makes it almost impossible. So, in fact, two of the great thought leaders of this university, Ludwig von Mises and Friedrich Hayek, talked about the impossibility of socialist calculation and the attempts to control an economy. So that we've seen the failures of the Soviet and the Chinese models to centrally control an economy, but the same thing is likely to occur. Governments want to believe that they can control or plan these viruses, and it is absolutely impossible. Whatever pretenses they have are as illusory or based on a misreading of reality, that viruses have their own ideas about what they're going to do, and it doesn't matter what political judgments are. It also turns out that when personal health is subjected to central planning. It's just like any other personal decision. It's going to be inefficient when it's in the hands of a bureaucracy or if it's driven by political logic. And what we've seen is that in many countries, the vaccine distribution, even though governments were committed to vaccines, they made a mess out of making these vaccines available. It wasn't merely a matter of cost. It was a matter of politicians wanting to be part of the process, taking credit for it, or perhaps enriching themselves personally, and so on. So another element here is that we should know that any one indicator, whether or not we're talking about personal health or any other issue relating to human life, any one indicator is not adequate. So, for example, what we saw in the early days of the pandemic, PCR tests were used as the so-called gold standard. And in fact, as we'll see in a moment, these were very poor measures of infection, contagion, and so on. Now, it turns out that governments sought advisors, and those advisors were the chosen experts, but these were chosen carefully in order to give the advice that the government officials, the public health officials wanted. No one had asked me to advise governments about pandemic policy because it's quite clear that my interpretation would be much different from theirs. Now, let's look at the impact of the virus in public policy. Now, it turns out when the pandemic began, I went back immediately and read all the medical literature I could find on the first episode of the SARS virus that we encountered in 2003. And it turned out that the risk factors were exactly the same in 2003 as they were in 2019, 2020. That is, it affected the elderly and the immunocompromised individuals. And so there were different risks for different age groups. Most of you here face a very low risk of both infection and a severe episode of disease. Economic sectors are affected differently. What we saw is that people like academics could stay home and Zoom their lessons, their lectures, and not lose income. So the public sector in particular, there was no income loss, but it turns out that the private sector suffered a great deal from not being able to operate businesses or, for example, restaurants, whatever it may be. Now, there's a lot of problems with measuring any data that is not simply objective data like a temperature. Most data is not objective, and it's the same with the healthcare measurements. So, for example, the aggregate data of deaths, infections, and cases, and we'll look at these in a moment. What's happened is that these are estimates, and there was an interesting change in the way that doctors and hospitals were instructed to indicate the cause of death from the SARS coronavirus. That if you had an infection within 14 days of the death, no matter what finally killed you, the hospital record was it was a COVID death. This had never happened before with flu deaths or any other virus like this. Now, the incentives for these data estimates in the United States, there were higher compensations made available to hospitals if individuals were diagnosed with having COVID-19. So we had some problems with the data on COVID cases. And it turns out, and we'll talk about this in a moment, there are a great deal of false positives, especially with the PCR tests that biased the reporting of the infections. Now, it's important that we start with distinguishing between the virus, which is the SARS-CoV number 2, and COVID-19, which is the disease. So what we have is a respiratory virus, SARS-CoV-2, and COVID-19, which is a vascular disease. Now, infections with the virus may not lead to a case. Now, this is important because what we see is that when we look at especially journalistic references, but also the comments by politicians and public health officials, they tend to conflate. That is, they mix the two together. They don't distinguish between infections and cases. And it turns out, for example, that a positive test, a PCR test for a virus, meaning that you have an infection, may not involve symptoms. And only if you have symptoms requiring medical care, that is being hospitalized or being under doctor's care, that is a case. The infection fatality rate is different from the case fatality rate. These are two different and distinctive issues. And unfortunately, a lot of confusion and a lot of the reporting on this pandemic has exaggerated the extent of the cases by declaring all infections as being cases. But many infections are asymptomatic, meaning that people are not a case or they were false positives. So the testing, the primary test that was used was a PCR test. More recently, we began to see the rapid antigen tests. But what happened is that these PCR tests can show a positive result even if the virus is cleared and there's no transmission risk. But they were using these PCR tests as a way of quarantining people and also contact tracing, even though the person who may have had this virus has cleared the virus. Now, it turns out there are also a large number of false positives that identified the non-infectious people. They were forced to be isolated. And this weakened public confidence to a certain degree. People were worried about undergoing these tests because they knew if they came up positive that they would be quarantined. Now, the problem with these tests is if they run them through too many cycles. So what they're trying to do is to isolate a viral fragment and magnifying it or duplicating it so that they can see whether or not that viral fragment is present. Now, it turns out that if they run it through too many cycles, more than 35 cycles, you get a meaningless result. Most PCR tests in the beginning were running through 40 cycles. And none of the test clinics would reveal the number of CT cycles they were doing. So in many ways, a lot of these PCR tests were misleading and exaggerating the extent of the problem with this particular virus. Now, the rapid antigen test, which has become much more prevalent now, it detects a protein fragment. It doesn't diagnose infection any better. And in fact, it has a high false negative rate, but it's better at judging infectiousness and contagion. And more importantly, it's cheaper than the PCR test. When I left Thailand to go to the United States, I paid over $100 for a PCR test. The rapid antigen tests are available for a small fraction of that. And you can, even though you might have false negative rates, because they're so cheap, you can run these things much more frequently. And these can be done at home, unlike the PCR test. So the rapid antigen test is probably a better tool to be used. And by the way, the PCR tests were available on emergency use authorization in the United States. And that, it's been announced already that emergency youth authorization will be removed at the end of this year, and sometime in December. So the FDA in the United States realized that this PCR test is not such a good indicator of the infectiousness of the virus. Now, the public policies have mostly been what we would call non-pharmaceutical interventions. For example, lockdowns or masking or measuring temperatures at airports and all sorts of things. Now, the impact of these policies have led to both fiscal and monetary a lack of discipline. That is, governments have thrown any sense of discipline out the window in order to fund the programs that they're supporting the public policies here. Now, for example, after these public policies cause economic distress in all these economies around the world, government said, well, okay, well, we got this problem now. We'll fix it by spending more money or borrowing more money to spend more money. And this has led to an explosion of public sector debt in countries all around the world. And central banks have assisted in this terrible policy by having these artificially low, almost zero or sub-zero interest rates in order to help governments be able to borrow money to try to fix a problem that they caused. That is, the economic slowdowns that we're experiencing are not based upon the pandemic by itself, but upon the pandemic policies. We didn't have to be where we are if different public policies had been chosen. Now, the United Nations has informed us that we will see 34 million people falling back into extreme poverty in 2020. So we're seeing a reversal. For the last 20 years, we've seen a persistent decline in absolute poverty, extreme poverty around the world. And what we've seen is that these pandemic policies, not the pandemic itself, but the policies have forced people to become impoverished again. Now, one of the big problems with this is that no government engaged in any cost-benefit analysis or examined what the trade-offs were. They simply followed China. China was the instigator of these lockdown policies, of this universal masking and so on. And all of this went, as we will see in a moment, all of this went against established public health protocols. And they accepted China being a dictatorial regime, but for whatever reason, governments pursued the policies that were implemented by a non-democratic country and did so without doing cost-benefit analysis of the impact of their policies. Now, it turns out all cost-benefit analyses are somewhat problematic because the inputs are subjective, but you must make your assumptions transparent, and that gives some assurance that people will know what you're looking at. Now, it turns out that health nor one illness should be put above all other aspects of life. What we've seen in this pandemic, one virus, which is only one among many viruses that are out there, was put above everything else. And health, physical health, was put above mental health. And health in general was put above all other things. And this is a puzzling thing. People live according to all aspects of life. A fulfilling life, we obviously care about our physical health, our mental health, our economic health, and our interactions with other human beings, our social interactions. And these public policies overlooked all these other aspects. They focus on a particular virus, on one particular disease, and ignored all other things. So, for example, we'll see that cancer research has been delayed by 2 years. So many more people will die from complications from other diseases, including cancer, because of the pandemic. Not the pandemic, but the pandemic policies. So people value other things other than physical health. You care about mental health. You care about access to food, your financial security. All these things have suffered. Human contact has suffered. People are now afraid of each other. The fear that's been used to promote these public policies has made people look at other individuals as a vector of a deadly disease, even though that is exaggerated. So human contact has suffered enormously. I'm sitting here at eCafe in the Escuela de Negocios. There's nobody here. The university is completely empty of students. People have been made afraid that they can't interact with fellow students or with university professors. People are staying home because the university is following the protocols given by the government. And this has, I believe, disastrous long-term effects. I think we'll see. Now, some governments are pursuing what we would call a zero COVID policy. For example, in New Zealand. New Zealand last week encountered one, I don't know whether it was an infection or a case because I don't trust their reports. But with one new infection, they shut down the whole country again because they are pursuing a zero COVID policy. Now, New Zealand is a small country, isolated because it's a couple of relatively large islands in the distant Pacific. But sooner or later, the virus will visit there. Whenever they open up, the virus will visit them. And their people have not been exposed to the early variants. And they're going to be more susceptible to contagion from the newer variants. And I think they're going to have surprising and perhaps very deadly experience with that, believing that they're controlling the virus. But the virus is out there. It's waiting for its opportunity. And once they end their shutdown, their isolation, the same in Australia, the virus will visit those shores. And I think that they're going to have a very bad time of it. I'm sorry to report. Now, one of the problems I believe has happened is that policy is not following science, that science is following policy. In other words, policymakers are coming up with a policy and then they look for the science or they seek out the scientists to justify the policy rather than the reverse. And the reason I say this is that most changes that have occurred in 2020 have gone against very long established scientific and medical protocols. And these have been used to support these non-pharmaceutical interventions, the lockdowns, the masking, and so on. So for example, up until 2020, if you read the scientific literature as I did, masks were not effective as a general strategy. Now, as an individual use, an infected individual, it might reduce the spread of a virus if you know that someone was infected, that they might wear a mask and you would perhaps isolate them. But as a general strategy, it was never thought that everyone should wear masks. And the reason for that was, well, we'll get to that in a moment, the nature of asymptomatic transmission. So for example, border closures were explicitly said to be not advisable up until 2020. But after 2020, the US closed the borders to first China and then to European countries, many other countries. New Zealand and Australia completely closed off. Lockdowns were said to be inappropriate and quarantine was only for infected individuals. But in fact, what happened after 2020 is that lockdowns became commonplace and stay-at-home orders, that is lockdowns, shelter-in-place orders. So everyone had to stay quarantined in a sense. This changed overnight. Emergency use authorizations were rarely given, but what we've seen is that they were given first of all for the PCR test and then very quickly for the various vaccines. Now, this is wrong. I made this slide up before yesterday. Now, the Pfizer vaccine was finally approved even though it has not finished its phase 3 trials. So the approval of the Pfizer vaccine is very unusual in that regard, because it is really not out of its experimental phase. Now, in early 2020, one of the United Nations officials that was involved with pandemic research was on record as saying that asymptomatic infections were extremely rare. And the reason is there is a low viral load. Within 24 hours, they retracted that statement. Now, that wasn't based on science, because science could not have developed enough insights within 24 hours to indicate anything different. Because this, even if it's a novel virus, it's still a respiratory virus, and it has many of the same attributes of every other respiratory virus, including the rarity of asymptomatic transmission. This was reversed. So all of these issues that had been in place for decades were reversed virtually overnight for this pandemic. Why? Well, it's a novel virus. And they claimed that instead of saying, well, we're following China's Communist Party policies, this dictatorship in China, instead of admitting that they're following the policies of China, they said that, well, it's a novel virus, so we have to treat it differently. Even though there was a great deal of data and information about a previous SARS virus, as I mentioned in 2003, and other highly infectious viruses that came after that, including MERS and so on. Now, the pandemic definition was also changed, where in this case, the threshold was lowered in order to declare this a pandemic. Now, I invite all of you to do this, because I tried to get an update on this. There is no good data on this. The various agencies, the public health, are not making the global case fatality rate available for COVID-19. Now, the last estimate I had was the one that's reported there, comparing it to the flu. Now, it's significantly higher than the flu, but it's much, much, much lower than it was, for example, the Spanish flu and other pandemics throughout history. Now, I invite you to go to Google or whichever search engine you use and try to find the global case fatality rate. It's very difficult to find an updated estimate of it. And I believe that's because they don't want to show, because the case fatality rate today is much lower than it was a year ago. Because in the beginning, what we saw is that the people at advanced age began dying off very quickly. Now, another thing that changed is the way that we measure the cause of death. Now, in the past, flu deaths were estimated. There was no precise measurement. But all of a sudden, if you were ever infected with the SARS virus, COVID-19 is the primary cause. So again, we're going to almost certainly come up with exaggerated, overstated estimates or measurements of these deaths. And if we look at the average age of the deaths, what we would interpret this as being is that most people who died of COVID-19 had accelerated deaths. That is, they were quite elderly, they had other comorbidities, so they died maybe 6 months or 1 year before all those comorbidities would have killed them anyway, and that COVID-19 simply accelerated their demise. It's in many ways, although it was dangerous for them, it was much less dangerous for most of the rest of the population. Now, what's happened is that, one of the headlines in Bloomberg said we have to prepare for a permanent pandemic. Now, this has never been the understanding in the past. What's happening is that public policy makers, rather than retreat from their public policies, they are consolidating them and planning to keep them forever. this is a very dangerous and problematic thing. The potential future, will it be a recurrent seasonal infection? Well, of course it will be, but will it be a pandemic or will it be endemic? That is, will it be something like flu or the common cold that we cope with every year? So they're trying to create the idea that this is unlike any other respiratory virus ever, that the variants have never occurred. Every virus mutates, and there is nothing new about this. These variants will constantly occur. They occur in reaction to natural immunity from a natural infection. They occur also, they're inspired by vaccines. Vaccines will trigger variants because the virus says, look, I want to survive. I'm going to find a way around these antibodies, whether the antibodies come from natural infection or from a vaccine. So there's nothing that is unknown about this, but somehow they're trying to pretend and treat this as something completely different. They're suggesting that herd immunity will not occur, and that the virus, but this is almost an impossibility, that herd immunity will not occur. Many people have been exposed to this particular coronavirus or other coronaviruses. They have T-cell immunities, they have other antibodies, they have B-cell reactions to these coronaviruses. So it's very unlikely that we will not reach herd immunity, especially with the vaccines. Now, so public choice gives us reason to question all of these views, whether or not we'll have a permanent pandemic, whether or not we cannot reach herd immunity. Now, what we have to understand here is that I think, unfortunately, too many people have lacked the curiosity to look behind all of these public policy declarations. And in fact, we've accepted coercive implementation of these public policies without examining what is the nature of looking at human immune systems, looking at vaccine development and so on, so that we have not really made informed judgments about what is being imposed upon us. Now, what has motivated governments to make people so fearful? And this has never happened before in the history of modern medicine or modern public health. Fear is a psychological weapon. It should not be an instrument of public policy. What we have seen develop with respect to COVID-19 is a psychosis, a public psychosis, a constant sense of fear. And human beings view other human beings with fear. In other words, instead of us seeing other human beings as ways for us to accomplish our life purposes with mutual cooperation and peaceful interaction, now we're dividing people. People have become less and less willing to interact socially or economically with other individuals, based upon, I believe, misguided public policies that reinforce a psychosis of fear. Now, what they've done is try to create this sense of helplessness in us, that we individually, that if we don't take these measures that they tell us, that we will be infected with a virus, and there's a high probability that either we will die from it or we'll transmit it to someone else. So now, is it possible that these policies are driven by ideology or some concept? Well, it turns out that there are a number of these concepts out there. You may or may not have heard about the terminology of the Great Reset or New Normal. These are ideological concepts where people who are opposed to capitalism as a general theme, or they see that the population of the world is simply too large, and that the behavior of the population is driving us towards global catastrophes according to their ideologies or their beliefs, whereas other people have different beliefs about what will happen. It's very likely that the population of the world will shrink naturally as per capita incomes increase in countries. We find that fertility rates drop, as has happened in Japan, Korea, most of Western Europe. We're seeing population being brought under control, not by government policy, but simply because people have become richer. They've decided to have smaller or perhaps no family at all. And so that many of these problems that are driven by this idea of the Great Reset or the new normal, especially with respect to population size, have been self-correcting. Now, political institutions gain resources from taxation, or they issue debt to create policy that are supposedly improving social welfare. Now, this is what we tend to believe. They're there. But the problem is there's a tendency for failure. This is the idealized interpretation of what, okay. Now, they tend to fail. And for a number of reasons. I'm going to go through this very quickly. I'll make these slides available to you. Now, the problem is crisis responses, like with the pandemic, tend to permanently increase the scale and the scope of political power. And that means that there's less liberty and less private activity. Now, the recession that we're experiencing and all the economic problems are from the policy choices, not the virus. So it was an invention of the state. We didn't have to be in this situation if they'd chosen different public health policies. For example, if they'd isolated the vulnerable, that is the elderly and the people that had comorbidities, that had immunity disorders and so on. If they had been quarantined instead of the entire population, we would have had different results. In other words, if public health policy had followed the protocols of the last 50 years, we would be in a different situation. Now, the economic recovery, because of the fear, it's going to be very difficult because there's been a loss of trust. How do we recover? Well, it's got to be through private initiatives and ending special interest privileges. Now, if we use state planning, it's going to be a big problem. So there's those two choices. The better choice is through the private sector. Now, I'm offering some suggested readings. These will be made available to you if you request my presentation, my PowerPoint presentation, and you can request it directly from me at my email address there, or you can ask the people at the Central Henry Hazlitt for these slides. Okay, I'm ready for questions. Luis?
Yeah, I'm right here. Thank you. Yeah, we have a couple of questions already. So we have Adriana Peralta asks on Facebook, is there one size fits all policy for a crisis like this? And like, can you say this at a national level or a global level?
I didn't get the first part.
Is there a one size fits all policy for a crisis like COVID-19?
Well, probably not. Certainly, we certainly shouldn't have followed the Communist Party of China. That was what people did. They said, well, China is a good role model for democratic countries. I find this unbelievable. Now, the response would have been to follow established medical and scientific protocols. That would be to not to lock down the entire country or economy, but to isolate vulnerable people. And the most vulnerable people were the people that were over 65, that had comorbidities, and that had compromised immunity systems. This would have been a much better way. What happened instead is that we were given policies that have proven to be ineffective. Masking, now that we understand, it was clear to me more than a year ago, respiratory viruses are transmitted by aerosols. Now, masks are not effective against aerosols. And if masks are effective, they're only effective when you're with a known infected person that is shedding the virus. And a better approach to reducing transmission is improved ventilation, where the aerosols are dispersed. The masks nebulize droplets into aerosols. And in fact, masks can make the transmission worse by nebulizing droplets into aerosols. The idea of fomite transmission. I see signs everywhere to wash your hands for 20 seconds. This was a very bad piece of advice. Fomite transmission, that is transmission by touching a surface, is almost, it is so rare as to be negligent. But the public health officials did not investigate the transmission. They pretended that this was a novel virus that they didn't know. But every respiratory virus, including the first SARS virus, was transmitted by aerosols, not by touching a surface where someone might have sneezed. You would have to, the amount of virus you'd have to contract with your hand. And think about, for example, if you care about the environment, how much water has been wasted over the last year for people washing their hands and using soap and the chemicals that were used to make the water potable, and all the alcohol and gel that has washed into the ocean. This is terrible, and it was completely misguided. The hand washing idea was an attempt to promote fear and to keep people concentrated on this virus, as I think masking was too. Masking was a way of keeping the level of fear of the virus at a very high level. And so these were instruments of fear rather than of prudent medical or scientific protocol.
Thank you. And I have another question. Considering what you mentioned during your presentation, like New Zealand policies regarding a complete lockdown because of one case, like in your opinion, what country has had the best public policy to fight COVID-19? And conversely, which country has had the worst public policy?
Well, I think China had the worst. The virus began there. The Chinese allowed their citizens without, they gave misinformation. The WHO promoted that misinformation. I was in Asia at the beginning of the pandemic. I was in places where Chinese from Wuhan were visiting. So I think I was exposed to the virus early on. And unfortunately, people saw China's tactics as being a model. How is it that democratic countries dedicated to democracy, to human liberty, to individual autonomy, would look to a dictatorial, autocratic regime as having the best public health policy? This is a mystery to me. Now, a better approach to the pandemic, I believe, was Sweden. because Sweden followed not China, but established medical and scientific protocol. Their public health officials said, once you enter into lockdowns, you cannot leave them. And we see this around the world. Every country that's had lockdowns, they've had to, once they remove them, they say, oh, well, no, everything has changed. We got to go back. So you had lockdowns here last year, then you had them again this year. Lockdowns are a gift that keeps on giving. It's the Hotel California of public policies. You can check out, but you can't leave. Once you have lockdowns, you're trapped. And Sweden understood this, and they resisted it. They resisted masking. They encouraged it, but they resisted it as a general strategy. They said, if you're with infected people, it's advisable as a personal strategy, but as a general strategy, it's not advisable. So China's the worst case. Sweden is the best case.
Okay, now going a bit on the international level, like, have organizations like the World Health Organization made this crisis better or worse?
One of the best things that Donald Trump did during his administration was to withdraw the United States from the World Health Organization. The World Health Organization has been extremely compromised by the Chinese government. They have ignored the violations of China, the hiding of data by China, and the World Health Organization has been giving bad advice. Now, relatively less developed countries like Guatemala depend very heavily on information from the World Health Organization. But unfortunately, they've been giving bad advice. I don't trust their advisors. Most of them, I tried to look this up. Most of the people that work for the World Health Organization have degrees in public health, not in medicine. They don't have MDs, and they're not scientists. They're mostly masters of MAs of public health. So they studied the history of public health. They didn't study medicine or diseases per se. They just studied the history of diseases, but they don't know that much about immunology or virology per se. They're bureaucrats. And those that are perhaps medical professionals are simply become bureaucrats, like Fauci in the United States. He hasn't practiced medicine or science in many, many decades. Although he has degrees, he's a bureaucrat. He's not a medical technician.
Okay, thank you. So we have time for one last question.
Okay.
And that I am paraphrasing Alessandra Maria Spilare's question on YouTube. She asks whether having public opposition from a lot of the people living in one country would have been useful to keep the governments from imposing these COVID-19 policies. Like, what is the probability of people fighting back?
Well, we do see some countries. We've seen in, again, it's not being widely publicized. The mainstream media refuses to publicize the demonstrations in Canada. There have been very large demonstrations against lockdowns in London. There's been substantial resistance in Australia. Unfortunately, New Zealand, I don't know what's happening there. But there were demonstrations in France involving hundreds of thousands of demonstrators. But this has been ignored because I think the mainstream media has bought into the fear and has promoted the fear tactics of governments, and they have resisted reporting on the kind of resistance that could have weakened the political dynamics that have imposed these lockdowns and these restrictions that have caused so much damage. Now, the thing is, the media is also not reporting on mental health, the increased suicides from social isolation during lockdowns, or the opioid crisis in the United States, for example. from social isolation, the loss of livelihoods, the destruction of wealth that has come from all of this. We don't have a balanced view about the high costs, not only the mental health, but the economic costs from these policies. And I'm really hopeful that that I think people should be going to Obelisco in much the same way to oppose lockdowns as you oppose corruption in this country in your political officials that help bring down corrupt regimes, or to bring corrupt public officials to make them accountable for their bad policies.
Okay, so one last question regarding that, like, and at an individual level, like, let's say someone like me, a student that has no real political influence, what can someone like me do in such a situation like this?
Well, live your life. Resist fear. I mean, fear destroys human life, and governments around the world are destroying humans' lives and the promise of your future. You need to resist it, and you need to use your influence with your friends, your family. Now, this pandemic has divided families. It's destroyed relationships. It's been the most destructive set of public policies outside of Soviet communism, I think, in the history of mankind. But we need to resist it wherever we can. And if the only thing you can do is yourself overcome the fear and develop enough deep curiosity to investigate some of these claims I've made. Now, what I've told you today goes against the consensus, the received wisdom. So test it. Don't simply say that I'm some crazy conspiracy nut. Develop your own curiosity like I did. I read extensively in the early experiences with these viruses and began reading about immunology. And I followed a lot of epidemiologists and so on. Even though I'm an economist, I wanted to know why governments are choosing the public policies, because as an economist, equipped with these ideas from public choice economics, I began to question these ideas.
Okay.
So I wish you the best of luck.
Thank you. And thank you very much, Chris. It was an absolute pleasure to have you here at UFM. On behalf of the Centro Henry Hazlitt at Universidad Francisco Marroquín, I thank you for attending this conference. Please join us tomorrow for the conference, ¿Quién es más libre, J Balvin or Queen? In that event, we are going to discuss if music is an expression of free speech, how capitalism has allowed more people to enjoy music, and a discussion between different music genres. Again, thank you very much for your attention. Good afternoon, everyone. And remember, have no fear. Thank you.
Yeah. Ciao.
Hoy, el mundo busca cursos en línea. Hoy, el mundo sigue las tendencias del mercado. Hoy, el mundo necesita emprendedores. Hoy más que nunca, el conocimiento se dispersó y la Universidad Francisco Marroquín no cerró. Se multiplicó en diversos hogares.